Good morning, everybody. Welcome to the California Apprenticeship Initiative's webinar for this April. We're going to be discussing the impact of apprenticeship on, we're going to be discussing the impact of COVID-19 on apprenticeship here in California. We're really glad you're able to join us. I do want to remind folks, I think we have restricted folks' microphones, but if for some reason you are unmuted, please make sure to mute yourself if you have the ability to do so. I think I'm hearing a little bit of static coming in over the line. I want to make sure that folks can hear me. Our folks, drop into the chat if you can hear me, and we'll just confirm that that I'm audible for everyone. Perfect, wonderful, thanks everybody. I'm so glad that everyone is able to join us here for the CAI webinar. This is a conversation that I think is really the elephant in the room for a lot of us, certainly everybody in the country, and we're really grateful that we're able to pull this conversation together on a pretty short turnaround time and be able to speak to it. So I want to go over just a few housekeeping things up at the front. You do have control over your audio in that you can toggle between computer audio and a phone call-in number if you're having difficulty hearing. I know now that the entire universe has moved to a virtual environment practically, it certainly makes doing virtual work such as webinars a little bit more dicey sometimes. There's occasionally more technical issues that tend to come up. So if you are having any audio issues, certainly feel free to use the call-in number. Next to your controls, there is a picture of a microphone or a phone handle, an old like rotary phone handle. You can select, there's a little upward facing caret next to that control, and if you select that, you can toggle between the computer audio or bring up a phone number and meeting ID number that you can call in as well. We also have chat set up, and we're going to be using chat to bring in questions. The questions have been set up so that they can go directly to all of the hosts and presenters that are on the call today. So we wanted to make sure that we could respond to everybody's question, and so we're going to be saving everything that comes in, and anything that we're unable to respond to today, we're going to follow up through the CAI hub on the workplace, or if it's appropriate, we'll also follow up directly to questioners afterwards, certainly by the first week of May or so. So everybody's working pretty quickly, but we do want to make sure that, if we cover any territory, you just have anything burning that you really want to get covered, that we're able to respond to you in a timely fashion. Also, if you do need to call attention to technical staff or anybody else during the webinar, feel free to raise your hand and we'll check in individually. So for folks who are not accustomed to my voice, I'm Caleb Van Docto. I'm with Social Policy Research based in Oakland. I'm currently based in my home office in Richmond, California. I'm part of a fantastic technical assistance team that's led by the Foundation for California Community Colleges, supporting the California Apprenticeship Initiatives under the Chancellor's Office. I am joined today by my colleague Vince Kohler, Senior Strategist at Social Policy Research, and I want to turn it over to him so he can facilitate our conversation today. Vince?
Thanks, Caleb, and thank you all for joining us this afternoon. As Caleb said, we are kind of in uncharted waters this spring. That's kind of an understatement. So I appreciate that you're joining us. I know this is probably not the first Zoom call or webinar that you're on this week, so I especially appreciate your dedication to the mission of your organization and to the communities that you serve by still being on a Friday afternoon. It's pretty clear right now that we're headed into a recession. And obviously that has a lot of implications for everything that we do as well. We know that the unemployment rate is on the rise. It's now headed past 5% in California and may hit 14% or more, according to some projections, depending on how long the stay-at-home orders persist. So what we can say, our understanding of such a decline is limited because it's really hard to compare it to anything else. And so we don't really know what to expect and whether the usual rules of recessions and recovery cycles apply. But what we've also seen with all that is going on, we're seeing how communities and service providers, workers and businesses have already started to retool their service models to continue to be of service at this time and to stay engaged with employers. So we're hearing how programs have shifted their training to go virtual, how some programs have shifted their missions from training to service. There's some core service corps that are now delivering meals, for example, where they used to do other activities or help setting up field hospitals and the like. So we are already seeing the shift, and I'm sure you all are spending day and night working on that shift. And so rather than saying that we know how to respond to this, to COVID-19 and what the impact will be on apprenticeship, I think this is an ongoing conversation that we want to kick off today. So with that, we want to go to, we have this in three parts. As Caleb mentioned, we're going to hear from a word from the sponsor, so to speak, from the Chancellor's office. And then we're going to talk to a training provider and apprenticeship coordinator, and also from the Division of Apprenticeship Standards about sort of their initial and their first experiences, and also how that's affected their work and how their reorganization, how the state is reorganizing the response as a result of COVID. So that's in three parts. Again, keep the questions coming in through the chat as we go on, and then we'll get to them toward the end of the session. So if we can go to the next slide. So first, I'd like to turn the conversation over to Nick Esquivel. He is the CAI Apprenticeship Coordinator for the California Community College's Chancellor's Office. In other words, everyone knows Nick, so I'm going to stop right there with introductions and turn it over. If you could tell us a little bit about your perspective on this, the situation we find ourselves in, and how the Chancellor's Office is helping to support the grantees as they go through this period.
Certainly. Can you all hear me? Can you hear me,
Yes,
Vince?
you're
All
coming
right.
through loud and clear. Thank you.
Good afternoon, everyone. This is, very trying times we're living in, and I hope this, the material we present before you today brings some relief to issues you're facing and concerns you have with your grants, working with your program sponsors, working with DAS. For those of you that are relying on RSI, the unpredictability about that. And so we want to provide assurance from the Chancellor's Office that understanding that we're working under emergency conditions, Title V, Section 58146, allows us to make changes to hold harmless districts that are under these emergency conditions. So recently, my colleagues with the Finance and Facility Planning Division put out a memo with regard to RSI or for the 320 reporting. So that's basically apportionment that goes out for all regular students. My supervisor, Javier Romero, and I are in the final draft. It's moving up the chain of command, and we're hoping to have guidance out for you all in the coming week. Hopefully not 2 weeks. Hopefully we can get it out next week. And without giving out much information on what the final verbiage of that document dictates, is basically we're trying to ensure that we fund programs in the current fiscal year as they would have looked like in a prior fiscal year 2018-19. So again, we still need some approval from fiscal and from legal, but essentially we're trying to ensure that the RSI funding, understanding that the students may not be there, will still maintain. Now, the Chancellor's Office is not responsible for the delivery of the methodology of education for your programs. That's decided when you're working with your respective JTC, UTC, and DAS. Of course, there's a role in which we approve that curriculum, but the decision for a program to cancel a program or to move to distance learning is really a local decision between the employer, program sponsor, and the respective district. So, I've been getting some questions on guidance for moving online. And so there's a number that have already developed their own best practices. Really, the standpoint I'm taking it at is if an auditor comes to your district in a year and you can't validate what portion of the related and supplemental instruction was lab versus lecture, and was that double dipping or not, that I have you covered based on this memorandum that you're going to be held harmless, and we're going to still try to fund you at what we would suspect the previous rate was from fiscal year 18-19. So again, it'll all make more sense once this memo comes out. I can share with you the one that's already public. I'll be posting that to the CA Hub, or I'll have Chanel or Josh post it to the CI Hub. And that memo is going to be called Attendance, Accounting Implications, and Guidance for Distance Learning. So again, we're doing everything we can to maintain RSI levels for districts, even if the apprentices are not there. And that's, that again, we're hoping to get that out soon. For shifting to California Apprenticeship Initiative grantees, for every grant that is eligible to be extended, we're definitely looking very closely at that. Of course, for the 15-191s and the 15-192s, my round one cohorts, those are all they're all finished, but we're still working on the closeout processes with that. For 16-191s, 16-192s, moving forward, on and on. We're going to extend every grant we can. We do have the luxury of 5 year of encumbrance and 5 year of expenditure periods on each of those grants. So to the extent that the state controller's office will allow us to potentially extend further, we'll explore that. So again, everything we can to make sure that in the COVID-19 times, that your programs are not suffering, and that the chancellor's office is doing everything they can to support your programs. Reporting is going to be kind of all over the place. So, I spend lately, it's been about 67% of my time responding to transitioning to NOVA, closing out grants, helping people catch up with their quarterly reporting. But that's all right. That's part of my job. So continue to send me those emails, and I'll do the best I can to respond to those. And that's really all I have to say for today. But you all know my email address. You have Josh's email, and we're going to be developing an FAQ. So if you're typing away questions right now, my hope is to have all your questions answered within the next week or the first week of May. I'm currently working on a pre-apprenticeship RFA that we hope to have out in the coming month or so, and then followed by a new and innovative grant, some of that nature. So the California Apprenticeship Initiative grants are going to be imperative as employment has risen so dramatically. So training and increasing the pipeline of pre-apprentices to state registered apprenticeship is going to be imperative for us. So we've had to make some modifications to the first draft of the RFA that I had ready. So look for that in the coming month, hopefully. Thank you.
Great. Thank you so much, Nick. Appreciate it. So you've heard it here. If you'd like to get your questions answered and be part of the FAQs, put them in the chat now, and then we'll make sure they get to Nick and his team, and they can, take that into consideration as they're crafting a comprehensive FAQ going forward. As I said, we're kind of in uncharted territory, so many things will require some adjustment, and it's great to hear about the hold harmless provision already and the RSI related issues, which I'm sure are on people's minds. So thanks again, Nick, for joining us today. Moving on now, we're going to go into kind of a roundtable discussion mode with two individuals, some of my favorite people in this work. I would want to say one more thing regarding sort of the role of apprenticeship at this time. What research shows is that apprenticeship economies that have strong apprenticeship programs recover faster out of a recession. And so one reason that it makes sense that that would be the case is that, of course, the closer your training happens to the workplace, the more quickly are you actually ready for the workplace. And that's one of the reasons that that recovery phases goes faster. And that also means that now more than ever, we actually need to continue the work of diversifying the apprenticeship, the strength of the apprenticeship system. And there's two people here that are intimately involved in that. Rebecca Hansen, who's the executive director of the Education Fund, which is a nonprofit partnership between SEIU and UHW West and the healthcare industry employers. And so that means she's a very important person at this time in particular. She's using her strategic vision with both head and heart for the SEIU members and for all of us, because of course a lot of that is healthcare related. This is healthcare related training that many of these workers are engaged in. So we're going to start with Rebecca, and then we're going to get to Eric Wood, the chief of the Division of Apprenticeship Standards, and we'll ask him some questions as well. So Rebecca, can you describe a little bit about the role of the Healthcare Education Fund and how it's dealing with this current crisis?
Sure. Yeah. So we are, as Vince mentioned, a multi-employer joint labor management training fund serving 100,000 workers in the healthcare setting in allied health. And we do this through a range of programs, including apprenticeship, partnerships with different community colleges around, workers basically advancing their careers into clinical pathways. We currently serve around, on a normal basis, we serve around 16,000 people a year who are either doing continuing education or other kinds of professional development and apprenticeship. And a lot of that is already online because we do serve working adults, adult learners who need flexibility and need sort of ease of access. So in transitioning in the last month or so, we've definitely seen a huge impact on the workforce, and we've been really focused on making sure that workers are aware of what's available to them online. We've also launched COVID-19 specific training in webinars, live webinars where workers can come and get support just for their own self-care, as well as, coping with and understanding disease progression in COVID, understanding, proper use of PPE and things like that. So it's a whole range of different training to really support upskilling to meet the needs in the moment. Another interesting thing that we've observed is that a number of people we represent and work with have actually been furloughed or actually having quite a bit of downtime because all of non-essential operations in healthcare facilities have been shut down just to focus on COVID patients. So because of that, we've actually seen an increased demand in some areas of our workforce who are looking to access and understand what their next career moves might be. They want to talk to career counselors. They want to find sort of significant online training. And I think many of them who were already enrolled in programs at community colleges and other career technical schools have been able to transition online. So we've been supporting that through creating a Chromebook lending program, as well as we're about to launch, I think next Monday, or even starting this Friday actually, an online 4-week training for distance learning through Coastline Community College. So a lot sort of to focus on what workers need now if they're involved in COVID-19 response, as well as just transitioning to online. And I don't know, Vince, if you want me to speak specifically to our apprenticeship programs as well.
Yeah, I was going to say one of my next questions was going to be about the apprenticeship program. I have one other question, though, about this kind of counterintuitive narrative about the fact that actually in some parts of healthcare, there's a little bit of a decline, right? We've heard of stories of hospital workers being furloughed at the time because, as you said, the elective part of healthcare is actually slowing down in relationship to the preparation for COVID. So how has that affected the training of both through either apprenticeship programs or others, how does that affect training in the allied health industry?
Yeah, I mean, going into the crisis, there was a lot of projections I think folks have seen probably around the fact that there was going to be a shortage of almost 500,000 allied health workers in California over the next decade. And that, in particular, real scaled need around some really apprenticeship friendly positions like medical assistant. And so what we've seen basically is that, I think that what's happening now is basically going to turn some of those projections on their head. We're starting to hear about employers who are talking about 20% layoffs in different healthcare facilities. And we know our industry is going to be hit pretty hard, like all other industries as well. There's about $200 billion, I think, in stimulus headed towards the healthcare industry. But at this point in time, I'm not sure it includes any focus on training or the workforce. But I think workers are starting to think about that, taking that into their own hands. I think they're sort of seeing the writing on the wall and getting concerned about like, hey, if I'm in a non-essential role, maybe I'm now interested in talking to the education fund about how I start my pathway into an essential role. Or if I find that I have time right now, maybe this is a good time to kind of tool up. So like, for example, at one facility where there's a lot of workers in an area who had been prepped for COVID-19, they're not being furloughed, but they're waiting in the facility, and the patient load has not been as severe as anticipated. We're actually doing like a skills day training all day online for them, where they can come in, they're going to train on like leadership and teamwork and, a whole bunch of sort of essential skills that likely will support them in any change. We're hearing a lot, and I know Eric's probably hearing about this too, around the need, for example, for 30,000 contact tracers to be trained up in the state of California, as the shelter in place sort of lessens or phases out, that we're going to see additional patient surges over months and maybe even over a year, right? Like that we're going to continue to sort of see this is going to have like it has an immediate impact, but it's going to have an ongoing impact. And so I think there's a lot of interest in, okay, what's the training needed to get those 30,000 folks in place? What are the long-term career prospects for folks who might come on to do those jobs? Like, how do we start thinking about how the model of care may change over time? And so I think with that in mind, a lot of workers are like, hey, maybe this is a good time for me to be thinking about what my next career step is, or how I might engage in online education while I have the time, in anticipating that my job will change significantly in the future.
Yeah, that makes a lot of sense. And in fact, some of the other trends that you've alluded to as well, the shift in how service is being provided in healthcare, how much telemedicine has come to the forefront and is being ramped up much faster than would have been expected in a normal trajectory. So tell us more about the apprenticeship side of the house. How's that evolving?
So I think like most people who are supporting clinical training programs, the in-person clinical has really been put on hold in these hospital and healthcare facilities. And didactic training continues online. So we actually do a significant amount of our didactic training online. And where that's possible, it's continuing. But we have seen most clinical training, all clinical training really put on hold, including for apprenticeship programs. In the past year, we've done medical assisting apprenticeship. Those folks were sort of near the end. And so some of them have actually moved into the medical assisting role, even though we had to postpone their graduation. They're basically at the end of their training anyway. And some of them had to return back to the job they had prior. We also completed a surgical tech apprenticeship this past year. Those surgical techs, are newly hired, but there's some concern because most surgeries have been put on hold during COVID-19. And so there's some concern like, hey, they might need support or refresher once this is over, or once they're more back to normal. We've also actually launched an RFP for surgical tech education partners for the future. So I think we're starting to use this time kind of to plan for the next phase of growing work for surgical techs. And that's, I think, being considered by several community colleges through the HWI right now. And then we are launching online didactic training for sterile processing. We had one group graduate of sterile processing apprenticeships. And I think the idea is like, sterile processing is needed as much now, as much now as ever. And that's going to be an ongoing need. And so while we can do the didactic training online, we can get folks started with the idea that down the road, they'll be able to be supported either towards the end of this year or maybe into next year in OJT. And then finally, we've also done medical coding apprenticeships almost entirely online already. And so even starting in 2015, our first medical coding apprenticeship with Kaiser was all delivered online, including the precepting, OJT portion of that job, because it is online, often remote work. And so we're continuing with those programs and developing those programs, just looking at sort of the flexibility around geography, can we sort of match coders to jobs in other regions and have the training and their work be completely remote, so that work moves forward. Programs we had for imaging, we have a group who's actually doing online didactic training for interventional radiology, and so their OJT may be delayed, but the didactic online is what's happening now. I think by the time they graduate, they might be in a position where they can go back in. We have a group of optical dispensers who completed didactic training online, and they're waiting. They're not able to complete OJT at this time, so they're paused. And then we are part of the Hybrid Training Partnership Grant, and through that we had several programs that are just entirely on hold at this point. One in the Bay Area for CNAs who were going to get a behavioral health certificate to be CNAs in a mental health facility. They will not move forward until a later date, we hope. And then in the Sacramento region, we were about to launch a pathway into materials management via apprenticeship, and that's on hold indefinitely.
Good to hear, though, that a number of those programs are still able to continue. Do you have a sense that, given this shift to online, which again in some of the sub occupational groupings were already kind of was the dominant mode of the classroom training portion of the training, do you have a sense that some of that, I mean, it's early days yet, but that some of that may be here to stay? That even if we go back to having open workplaces and open hospitals and so forth, that some of the training will stay online, or is it just too early to say what the long-term impact will be of this shift?
Yeah, I mean, we were already headed in that direction anyway, because I think we serve a really geographically dispersed population, and a population that doesn't have a lot of extra time to commute to different locations. And so I think we were already headed in the direction of trying to match as much online with in-person training. And I think really that hybrid model is ideal. Not everything is done online for a lot of these clinical positions, but to the extent that online education can be utilized, we think it's a really amazing way to sort of accelerate and create accessibility for students who may be working full time, have kids, et cetera, right? So that, I agree, this is sort of, I think, spurring that forward. And I'm sure, for those of us with our own kids, it's like, I feel like I'm trying to get a 3rd and a 6th grader, prepared for distance learning. Like, it's a big lift. It's not a small lift, but I think, we all kind of have to learn how to do more online. And I don't think I think you said this earlier, Vince, it's sort of like accelerating something that was already the trend, even for telehealth, right? So yeah, I think, yeah.
And last but not least, you're also the chair of the Interagency Advisory Committee on Apprenticeship, IACA, as we love to refer to it. I know that work is also affected directly by our stay-at-home orders. So how can you tell us a little bit about how that's progressing and what that may mean for a way to interact with that committee, which is focused on non-traditional apprenticeships in the state of California?
Yeah, so I think that the work of IACA has really been focused on how do we expand apprenticeships and advise DAS in expanding apprenticeships into new industries. And part of that, and part of the direction that we've been bringing to that work is to help to create MITCs, or minimum industry training standards, and really work with our subcommittees in different industries to understand what are the key criteria that will support both sustainable model and industry-driven model, and a model that protects apprentices, right? So there's been a direction, I guess I would say, coming forward around the work that IACA can do to really support the development of those MITCs as a way to focus our energies in non-traditional apprenticeship and really develop something that has lasting power. I think that that work will continue, and it's more important than ever because I think we're going to have such, I think as Nick maybe said this, or maybe you did, Vince, like there's going to be this dramatic impact on our workforce. We already knew that there was, a significant number of folks sort of left out of the opportunity and promise of California that we wanted to bring into really, programs that resulted in middle wage, family sustaining jobs. And I think that we're going to need to sort of figure out how IACA can play a really valuable role in taking almost like a high road approach to economic renewal coming out of what is looking like a really bad situation for a lot of our residents.
Yeah, I appreciate that. So why don't we ask Eric a few questions as well, and then deal with questions that come in from the audience as well. So Eric, you are chief of the Division of Apprenticeship Standards, and one of the first assignments that is handed to you is how to retool your division, and then this comes and affects the workforce system as a whole and creates this whole new set of needs. So tell us a little bit of what it looks like from the Division of Apprenticeship Standards. How has that affected your work, and how are you able to, how are your employees and your consultants able to respond to requests that come in from the field at this time?
Great, thank you everybody. Well, good afternoon. Hope everyone's safe during these extraordinary times here. The Division of Apprenticeship Standards is actually part of the greater Labor Workforce Development Agency, and right now we're being called basically to have all hands on deck in really dealing with, there's three key issues that we're really looking at, but in the short term, it's how do we get benefits out to so many individuals. As of this week, we surpassed the 3.5 million mark as far as unemployment insurance claims. And so benefits is a big issue right now with the Labor Secretary. The second is how do we keep the workers that are essential safe during this time? So the role of our Cal OSHA and our Labor Commissioner's Office to protect the workers as far as their safety, hours worked, and making sure that they're getting paid is number two. The third item is really more in our bailiwick, which is the workforce. How can we be prepared as the governor starts to reopen up our economy and as we move forward? So this is, with these three items in front of us, I received a call probably 2 weeks ago from the Labor Secretary asking how can we redirect some of the Division of Apprenticeship Standards staff to help with a new pandemic unemployment assistance program, which is this big funding package that came out of Washington, D.C. For individuals that have historically not been qualified to get unemployment insurance. So this is a lot of folks that are independent contractors, it could be small business owners, it could be, folks that are, pre-AB5 workers classified as independent contractors that have traditionally not been eligible for unemployment benefits. So I am currently right now working with the Employment Development Department's Chief of to move a significant portion of my team to help with this new pandemic unemployment insurance program. So that is definitely, in the short term, is going to have an effect with my staff. We're going to have a skeleton crew right now of about 12 to 13 individuals that are going to
Eric, I think we have lost your audio.
Can you guys hear me?
Okay, now you're back. Okay. I wasn't sure whether it was on my end, but it looked like we lost your audio. Go ahead,
Hello?
Eric. Go ahead. We can hear you.
Oh, I'm back. I'm sorry.
Okay.
My
You're
technology, you gotta love it. Yeah, for the most part, I mean, for us, what we're trying to do is really triage, assisting our programs that are in different phases of obtaining other, as far as getting registered apprenticeship and pre-apprenticeship. And we've actually created some email boxes that we have actually as part of the slides to be able to access questions, get some technical assistance and what have you, as a lot of our staff is being transitioned into this new pandemic unemployment insurance assistance program. The other thing that's of note, you gotta love the timing, the U.S. Department of Labor also has recently advertised a next round of state apprenticeship expansion grants. And we do have a mandate by the Labor Secretary to chase federal dollars if possible, if it makes sense. And so we're right now analyzing a U.S. Department of Labor grants, state expansion grants that potentially could, we're still kind of evaluating how much we want to put into it, but potentially give us up to about $6 million in federal dollars to help us as we come out of this pandemic and as we start reopening our economy. So, did I answer your question? And
Yes, I appreciate the perspective. And I think we lost you there where you were talking about how grantees could continue to work with their consultants and sort of what, let me ask you a question, maybe the question in a slightly different way. If a program changes because of the shift in the way the labor market looks, or maybe an employer is no longer able to do what they thought, they're not able to to hire as many participants, or not able to hire any at this point, at what point when a program shift is occurring would that trigger a need to inform DAS of those changes? And then by extension, what would be the best way for folks who are working on either on an approved program or one that's in the approval pipeline to be in touch with your department, given the fact that you just mentioned, much of your staff has been redirected, at least for temporarily?
Yeah, so in the short term, I think it's going to be our biggest challenge as we have our staff moving over to the Employment Development Department. We're looking at most of our staffs, the redeployment is going to take place on April 30th. And a lot of their work, I would anticipate over the next 30 to 45 days is going to be with really trying to assist on the benefit portion. As far as programs that are currently in process or need technical assistance, we are setting up, like I said, an email box that will be reviewed by a specific person. We have 3 individuals that will be staying on to really look at servicing our apprenticeship programs that are our CAI grantees, including being headed up by Kelly Mackey, who's our director of apprenticeship and workforce innovation here in Northern California. And so again, there may be some delays just because of just the resources that we have here in the next 30 to 45 days. But we want to be also responsive to the needs of our programs as well. As far as programs that might have shifting, we're in an unknown, right? As far as the economy and what have you. Work closely again, I think that if we have a short-term, I look at the short-term 30 to 45 days, we're going to be a little hamstrung as far as resources. But after that, work closely with your consultants, and as far as letting us know trends, issues, how we can assist, everything, as far as really at the end of the day, we have an obligation to make sure that our apprentices, are protected, but at the same time, we want to make sure that we provide guidance to our employers, and so just work closely with your assigned consultants. We will do our best here in the short term to meet needs, but I am anticipating the part 3 of the Labor Secretary is to be ready for us to reopen the economy. And that's really, we're going to have our resources back. We're in the process also of aligning our workforce divisions, panels, and boards all into one department. As of now, it still appears that that's happening. And so as we're applying for this opportunity for this federal grant, we're making the assumption that we're doing it under our workforce world, even though it's specific to state registered apprenticeships. So there's a lot of work behind the scenes that's happening at the moment, but we're also leveraging the strengths of our folks that are at the Employment Development Department's Workforce Services branch and the California Workforce Development Board, who are quite familiar with chasing federal dollars and administering grants. And so that's what we'll be doing there. So as far as just keep it, let us know specifically if there's issues. I imagine that
And I think you cut out there for a second again, Eric, but that's appreciated. I'll ask you a question and hopefully you can hear it along the lines of what you just mentioned that has come up through the chat and may also be brought directly to your attention. Can you hear us, Eric? All right, I may ask the question again. Okay, there you are. No, we hear you. Can you hear us?
About that, it seems to be going in and out. I apologize.
This is technology. So the question that I had for you is regarding the requirements.
Yes.
Okay, regarding the requirements of OJT hours and training hours. This may not be a question you can answer at this point, but it might go into the frequently asked questions that DAS is going to be confronted with. Are there accommodations, or is this something that's under discussion of how, say, that minimum number of hours could be adjusted, given the fact that now the OJT portion of an apprenticeship is particularly challenging? Again, what are your thoughts, or what are the discussions at this point on that topic? Did that come through? All right, well, what we'll do is we will pose that question to Eric, and then he will make sure that that gets posted back, the level of discussion on that question. In the meantime, I have a question for Rebecca. Do you see do you see any early COVID impact on apprentice attendance in programs that are continuing to operate? Are there any concerns regarding the safety of apprentices in the allied health professions?
For sure, in the sense that that's why all the in-person clinical training has been shut down. It really is for the safety of apprentices that has happened. And I think that's happened for clinical training, broadly speaking, not just apprentices. But I would say that we do have a sense of overall, so the in-person training is on hold, essentially. I do think that I've seen some evidence that different organizations in California are working on, and I'm sure across the country are working on sort of creating simulation in clinical training that is in, a safe and sterile environment. And so that might be one of those sort of innovations that comes out of this moment, is figuring out things that can be done in simulation to continue to further healthcare education and training during COVID-19 or to replace that in-person clinical training. But the other thing I'll just add is that overall this year, year to date, we've served around close to 5,000 students. And I do know that we've only seen about 52 of those students actually completely drop out of programs due to COVID-19, based on really the issue of not being able to get online. So that's my only sort of metric, I guess, to date. But we're continuing to really monitor and understand sort of the impact of COVID on our students in the allied health pathways. And apprenticeship, in all honesty, is such a small piece of what we do, even though most allied health training is sort of apprentice-like in the fact that it has OJT. And I do think that OJT is really impacted at this time.
Yeah, I heard some interesting examples of how, especially the issue of, do students have access to the internet, or at least internet at the speed that they need? Some of the community colleges in the East have, provided boosters to their Wi-Fi network signal on campus, so that students could drive into campus, into the parking area, and pick up that signal in rural areas where they don't have signal at home. So there are all sorts of ways in which folks cope with the concern that not everyone has, internet at a speed that makes it easy or even practical to be in an online course. So so that there are all sorts of creative ways in which this has to be addressed.
Yeah.
For sure.
Yeah. No, and I think planning forward for just like, how are we helping serve a workforce that's in such major transition? I think being able to kind of get training available and online and sort of modular and industry demand based, I think is going to be a huge opportunity and need.
That's for sure. So this brings me to maybe one of the final question, not quite the final question, there are still others coming in, but the question that's been kind of on my mind: what is on your wish list? I know that there are some issues that have to do with safety of healthcare workers in general. I've seen the sort of Bill of Rights for healthcare workers. What about the wish list on the training side and the capacity building side? Training for healthcare workers, what would you put on the wish list? As you said, we are now seeing some of the issues exposed that have always been there. They're not unique to this crisis. They're just a little more stark in relief because of the crisis, or more in the public eye because of the crisis. What would you put on the wish list for training programs in the allied health professions in particular?
Well, I think something that's been on the list but is even more relevant is probably the idea of credit for prior learning, credit for prior experience, in the sense that, if we have a workforce in transition, if we have people moving from one industry to another and they have transferable skills, like, we want a quick and easy way to sort of give people credit for what they've done. And I think, I don't remember if it was Vince, you or Nick at the beginning just talked about one of the issues I think that's happening right now is, even in a place where, say say that we had a shortage of respiratory therapists, you know, that's a multi-year training process to develop the expertise that you would need right now. So even if we start today, we may not have had those folks, you know, if somebody's starting now, they wouldn't train them. But I think in general, the idea of like ways that we can accelerate the training process for folks to get them back into the workforce and into an in-demand job, you know, as quickly as possible is huge. You know, definitely always think about how we can improve the quality of online education, you know, and how we can partner at scale so that, you know, training and education is offered in flexible, modular ways online so people can access it. And I know there's online access questions. We definitely have to deal with the equity issues in online access. So I think a focus there is critical. But even once you are online, I think having training that's, you know, industry driven, so it's responsive and current with employer needs, and that is high quality and how it's delivered. It's not easy, and I don't think it's like the norm, so to speak, but I think us finding the best practices and really finding ways to expand those into the high demand areas for skills and jobs, and really make it accessible. I think that's a key need.
Yeah, it seems clear that it really is so important to take these lessons and now with the need so clearly in the public eye, make the changes that are needed and would have always been needed. But maybe we have a little more will, or not the will has always been there, but the allowance to make those changes. I just wanted to mention, in answer to the question that was posed earlier about the OJT hours and training hours. Eric just texted me, since he couldn't be on the line for the audio portion, that DAS is formulating a frequently answered question document as well for programs and sponsors. And overall, his direction to his staff is to be as flexible as possible. And of course, on the IACA side, so in the non-traditional program side, the programs do have the luxury of having a competency and hybrid apprenticeship program option anyway, which under the CAC side of the house, the more traditional apprenticeships is now possible. So the other thing that Eric mentioned is that he's interested in hearing about those OJT challenges, because again, we're in uncharted waters. It's good to know what the issues are that pop up on a day-to-day basis. And again, some of them may be unique to the current situation, and some may not be all that unique at all. And so, but they're again brought to the forefront. So let's keep those questions coming. The one other thing I wanted to mention, I asked a question earlier today, just in anticipation of this webinar, sort of where are we with registrations of apprenticeships? Normally, this is not a number I knew before either, that there are about 1,000 new apprentices per week registering, or programs that accommodate about 1,000 apprentices per week. We're now down to about a quarter of that, 250 to 350 per week. But there's still programs starting and apprentices starting. So that's both encouraging, but also gives us a sense of the scale. And of course, much of what we're looking at is still kind of a lagging indicator of where the economy is going. We don't know how long this downturn lasts, and so that's kind of hard to know. Here's another question, kind of an interesting question. Are there initial thoughts about how apprenticeship training facilities, the physical spaces themselves, might be redesigned? You know, touchless surfaces and things like that, ways in which we actually may have to redesign some public spaces. I heard Dr. Fauci say maybe we'll never shake hands again in the future. So I don't know. This is a kind of a slightly in a different direction. Rebecca, any thoughts as to how spaces might be redesigned?
I've also heard that in terms of like what it's going to be like when you go to the doctor, or like you made the point earlier that we'll do as much telehealth as we can now, right? But yeah, I think that, you know, the social distancing of students, the social distancing in, you know, seeking care, all of that could impact And I do think that there's going to be also a shift towards, and there was already this shift, but I think again, this will accelerate the shift out of the four walls of the healthcare facility and towards home-based care. You know, it's still, I actually saw an article today about how sending people home has actually created a lot of issues in people's homes around how infection control happens. So, you know, I don't know that home care is always the easiest way to do infection control, home-based care rather, but I do think that, you know, this may impact, for example, like you won't be able to pack your 20 MAs into a small conference room or, you know, coders around a conference table to do in-person training. It's going to be much more likely that you're going to need to have like significant distance between people and like you said, you know, like less physical contact. And so I think it's going to be, you know, an impact. I don't know. I have my mother-in-law's at home doing rehab at home, and her rehab, she just had a surgery before this happened, and like the home care worker's not coming anymore to do rehab, right? So it's like, right. I don't know exactly how this will play out, but I do think, you know, it's going to have a huge impact on schools. I mean, folks on the phone from community colleges probably have a better sense of how the schools are starting to plan for that. I don't think the hospital facilities, I mean, that's part of why they moved so much care out of the facility, was just to have fewer people there with the potential to contract COVID on site.
Yes, indeed. There are a lot of ways in which this could affect us, and we can't even know that yet. I do want to thank both of you, Eric and Rebecca. Eric, without the audio, but thanks so much for being available and being on. I know this is a crazy busy time in terms of making changes to the programming that you're working on. I also wanted to mention some of the silver lining that we can see, again, is how programs are coping with this, how we shift some of the service provision, doing some registrations online, over the phone, in ways in which, again, some of this may stay with us into the future. It may stay beyond COVID, but for right now, it's a coping mechanism. So thanks again. Here is contact information for everyone that you've heard from today. And also Eric mentioned this in his comments, that there are ways in which you can still stay in touch. If you already have a consultant, keep staying in touch with them. But if you can't get through, here are the leads in the regions, and also a lead for anyone where, if you're not sure where to go, send it to das@dir.ca.gov. Again, thanks so much, Rebecca, Eric, and Nick, and also to Caleb, who's going to take us out of here and maybe make an announcement about what's next.
Yep. Thanks, Vince, and thanks all for joining us. And many thanks to both Nick Esquivel, Rebecca Hansen, as well as Eric Rude, all three of you. And thanks all for joining. For folks who were unable to either get your questions asked or have something that you think of later on, do feel free to email. You can email that directly to me. There's my email there. You can also reach out to my excellent colleague at the Foundation, Chanel Brumfeld, and either one of us can make sure that questions land with the FAQ, both to speakers as well as to the Chancellor's office. And then do keep a lookout for our next webinar that will be coming. It should be on most folks' calendars, but the next webinar will be on the 5th of May. So we hope to have you back for that. In the meantime, very best with your week and your weekend. Do stay safe, take all good care, and let us know how and where we can support. So with that, thanks all. Have a very good rest of the weekend, and we'll see you on down the road.